Most people meet dialysis on the worst day of their lives. I met dialysis twice, once as a nurse and once as a patient. And something I never expected happened. I became a dialysis patient. Not someday, not years later, me on the other side of the chair. Not someday, not years later, but me on the other side of the machine. Suddenly, I wasn't the one explaining the process. I was the one sitting in the chair, feeling the needles, watching the clock, losing energy, independence, and parts of myself I didn't even know what they were yet. This channel exists because dialysis is not just a medical treatment. It's emotional, it's relational. It changes how you see your body, your future, your partner, your family, your identity. And no one talks about that enough. Here, we are going to talk about what dialysis really feels like. Not the brochure version. Accesses, treatments, medical realities in plain language. Fear, grief, anger, and yes, acceptance. Sexual dysfunction and intimacy, because yes, it matters. Relationships, marriages, families, and the strain dialysis puts on them. We'll talk about mental health, restlessness, sleep, anxiety, neurological symptoms, the things that nurses don't always have the time to explain, and the things patients are often afraid to ask. Sometimes I'll teach, sometimes I'll just talk. Sometimes I'll listen. This isn't a lecture. This is definitely not a lecture hall. It's a conversation. I've seen dialysis from both sides. I know what it's like to explain things clinically, and I know what it's like to live with them at 2 a.m. when you can't stop moving, can't sleep, and can't turn your brain off. I'm not here to scare you. For sure, I'm not here to scare you. This is scary enough. I'm here to tell you the truth with compassion. If you're a new patient, a long-term patient, a spouse, a family member, or someone who just feels lost in this world, you're not alone. I'll say it again. You are not alone. I don't know how much time I have left. Dialysis has a way of making I don't know how much time I have left. Dialysis has a way of making you very honest to yourself. I don't know how much time I have left. Dialysis has a way of making you very honest with yourself. But I know this. If I can make the journey easier for even one person, if it can help someone feel less afraid, less ashamed, or less alone, then this life still has meaning. This channel is my way of giving back what dialysis took and what it taught me. If this resonates with you, subscribe, please. We need all of the subscribers we can get. Keeps the channel moving, I guess. And it makes me feel validated. But so we can walk this road together. Together. Oh, shit, no. If this resonates with you, subscribe, please. Yes, please subscribe. Not for numbers, not for algorithms, but so we can walk the road together. Welcome to Mark Living with Dialysis.